presentation which shows Samshamani.
We are starting.
Yeah, okay.
We are starting.
Namaste and welcome friends to our weekly virtual speaker series on Ayurveda, the pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicine. And today is our 10th session on Samshamani Vati. Our special guest this morning is Professor Dr. Ish Sharma, academic chair Ayurvedic medicine at University of Mauritius. He is a global figure on Ayurveda with over 25 years of experience in Ayurveda education delivery, training, and patient care. Ayurveda tourism in EU and Asian country. Thank you so much, Dr. Ish, for joining us, and we're looking forward to your insightful comments today. And friends, our presenter today are Dr. Tejas K. Man, Ayurvedic consultant, and Dr. Shreyas S. Associate Professor Rajiv Gandhi at Society. Very, very warm welcome to both of you. Friends, week after week, we are very blessed to have these experts who are joining us from their busy schedule to share their knowledge and wisdom us, and we can't thank them enough for continuing supporting this initiative. As we all say, one candle can light thousands of candles without losing its own light. So their knowledge and wisdom is lighting up many hearts and minds of Ayurveda, that how we can inculcate the habits of Ayurveda, adopting them not only on the disease management side, but also on the prevention side. And it's a flowing river, week after week, we all continue taking plunge into it. And I want to also acknowledge and convey my sincerest thank you on behalf of Canada Indian Foundation and all the participating organizations, to special gratitude to our Nareji for providing much needed guidance to this initiative. A sincere thank you for your support also. With that special note, I want to pass on to Dr. Harish Verma, and we look forward to this exciting presentation. Over to you, Dr. Verma.
Thank you, Sriji. And viewers, today we shall discuss the pharmacological and therapeutic effects of Samshamani Vati, which is prepared from a very famous Ayurvedic herb called Guduchi. It is also known as Giloy, and the Latin name of Guduchi is Tinospora cordifolia. During current pandemic, Guduchi was found to be very effective in positive cases of COVID-19, and it was recommended by Ayush Ministry as well as traditional Ayurvedic practitioners all over the world. But recently, there was an article published in PubMed by the group of hepatologists from the Liver Club India. They observed that Tinospora cordifolia caused liver injury in cases of AIH, autoimmune hepatitis. And we have two experts today, Dr. Tejas Mon and Dr. Shreyas. So they will enlighten us about the pharmacological and therapeutic advantages of Samshamani Vati. And there are two types of Samshamani Vati available in the market. We will also discuss. And we have today a very special guest, Dr. Ish Sharma ji. He is a academic chair in Ayurveda in University of Mauritius. And he will also enlighten us about the current status of Ayurveda, because outside India, Mauritius is the only country where Ayurveda is regulated. However, it is regulated in Sri Lanka and Nepal also, but recently it was regulated in Mauritius. So Dr. E. Sharma ji will give us, will throw some light on how the Ayurveda can be regulated in other parts of the world. So I'll invite now Dr. Madan Thangavelu to moderate the session. Over to Dr. Madan Thangavelu. Thank you, sir.
Harishji, namaskar. Thank you for bringing us all together again. We're very happy today to be looking at another formulation. In our previous event sessions, we have looked at powders. We have looked at ghee-based preparation, Brahmi Gritha. We've looked at water alcoholic preparations. And today we look at another formulation, a set of formulations called Gan Vatis. Vatis being tablets, and Gan is a term used for a way in which you take the kashayam, which we've learned in our previous sessions, and then you boil it and you solidify this. Now, this preparation we're going to talk about today is especially useful for handling fever, and as Harishji says, it was recommended for COVID-19, was very effective. But before we go to our two speakers, I want to introduce our very special guest today, Dr. Sharma, Dr. Ish Sharma. Ishji, namaskar. Ishji is, India has Ayush chairs, professors located in different parts of the world. Here in Europe, we have a professorship in Latvia, in Riga. And Ishji is the second current Ayush professor. He's located at the University of Mauritius in the Indian Ocean. And in his prior to becoming the Ayush chair, he was involved in academia in several locations in India. And prior to that, he studied Ayurveda in several locations in India, including, if I remember correctly, the National Institute of Ayurveda in Jaipur. And prior to that, he studied in Punjab. We're very fortunate to have Harishji here with us. Harishji has several responsibilities. One is to take Ayurveda and its teachings to Mauritius, who are not unfamiliar with Ayurveda because they have in the past a lot of experience with Ayurveda. But Ishji has an additional task, which is to look at and monitor and survey the need for Ayurveda for the 54 countries of Africa. Mauritius is one of the member states of WHO Africa, and we are very fortunate to have Ishji here with us. Ishji, the floor is yours. I know you are a busy person. You have been interacting with all of the political offices in Mauritius, and you have done pioneering work in establishing a medicinal plant garden at the presidential palace in Mauritius. Welcome to our platform. Thank you for finding time with us.
And thank you very much for the wonderful introduction. And thank you very much, Harishji. Nice to see Dr. Tejas after a long time. And I'm here just to listen to you, Dr. Mon and Dr. Shreyas. Maybe as advised by Dr. Harishji and Dr. Madanji, if I can take 1 minute of the esteemed audience regarding updating what we are doing in Mauritius. What is the status? Ayurveda got approved by an act in the year 1989 in Mauritius, and Mauritius, having a population of like 12 lakhs, 1.2 million people, has got 20 practicing Ayurveda doctors, out of which 8 are in the government sector, and almost 12 which keep on coming and going are in the private sector, including some resorts and private trust, non-profitable organizations, etc. I have been around for last 10 months, and what I have been able to do in these 10 months, as Professor Madanji highlighted, we are coming up with an Ayurvedic garden at the Rashtrapati Bhavan, what is called a state house in Mauritius. It's like a 55 acres property, out of which 4,000 square meters has been given to us to develop an Ayurveda garden. I have suggested it to have 80 species, out of which 50 are locally available and 30 would be got from India in the phase 2. And we are very fortunate. The President, His Excellency, told me that he has a vision that whenever a state guest, any international guest comes to visit him, he would take them around and show them the potential the herbs contain. So this will be like a signature, like what we could not pull off in India, we'll be learning from Mauritius. And another big achievement which we could undertake is Mauritius is having more than 2.5 times the NCD prevalence as compared to the world. Like diabetes and obesity, if we include like overweight and pre-diabetics, they stand at 52% each. And cancers, heart diseases, lung diseases, all NCD are rampant. Like 8 months back, I could get a chance to meet Honorable Vice Prime Minister Madam, who happens to be the Education Minister as well. And I requested, if we catch them young, if we educate your children in the primary school, then we can have a hope to have your NCD population equal to the world average maybe after 30 years. So we have to start teaching them when they are in their habit forming years in the primary schools, primary school classes, which are 1st to 6th in Mauritius. She was very happy, and very soon, like within a matter of 3 to 4 months, the matter was processed, and on May 27th, the Parliament passed this bill that the Ayurveda diet and lifestyle tips will be included in all the grades from grade 1 to grade 6, which really we have been trying to have the same scenario in India for last many years. But India being such a huge country, being such a vast country, and the academics being a state subject, it might be very difficult because there is so much of variability. States might have their own say. Maybe Central Board of Secondary Education could do something, but anyway, this being a small country has got its plus points as well. And I'll be concluding with the last information to you. As rightly pointed out by Harish ji, that apart from the India and neighboring countries, this is a rare country where Ayurveda is fully approved for many decades now. And Government of India is funding a project to bring up a big Ayurveda institute, including a 50-bedded hospital and an Ayurveda college in Mauritius. Both the Prime Ministers have announced this thing 2-3 times, and the land has been allocated. It is in the drawing phase now, and we believe within 3 to 6 months, the construction would take off. And within 1 year, we could see the first phase, which would be a very modern, a very aesthetic, good-looking Ayurveda hospital, functional. And after couple of years after that, we can imagine to have BMS classes taking off. So thank you very, very much for patience listening. And maybe if anyone can unmute and discuss, if you want to ask something or share something or add something, if Harishji permits, then we can have some more discussion.
Yes, Dr. Ichi, thank you very much. My first question to you is, can you give us some insight how one can think of bringing Ayurveda chair to their countries? Because many people in the West, they are listening to you. If you can give us the practical tips to whom we can approach, and what are the steps to bring a chair, academic chair, yes, in particular country, that will be very helpful.
Yes, because the Ministry of Ayush is very proactive. They are doing real wonderful work, and it is the procedure is Ministry of Ayush should be signing a country-to-country MOU which would be fine-tuned by the CCRAS with the top government university of that country. It can only go to that a state government university or a central government university of that country, and the designation will be, which these are the guidelines, would be known as like a professor of medicine in the faculty of medicine in that particular university. The latest being like West Sydney University, where someone would be joining soon. We have got chair MOU with 13 countries, and unfortunately, only 2 are operational as of today. 11 are waiting incumbent to join. So I believe the Ministry of Ayush and CCRAS are working very hard to fine tune who could be going where. But chair MOU is very, very important because this is the first legal approach to authenticate Ayurveda in the healthcare system of that country. And I believe there being already like 14 MOUs already being there. Many more would be in the pipeline. And Australia is especially promising because this would be open the gates towards like developed countries, like much beyond developing and underdeveloped countries. So we are very much looking forward to a wonderful placement and a real like groundbreaking approach where the Western world would open arms towards Ayurveda. Harishji.
And what kind of funding is required by the Ayush from Western universities or the foreign universities?
No. Ayush requires no funding. Ayush gives funding. All the expenses are paid by Ayush. The university only has to do one thing. A university would be offering you, like the University of Mauritius offers me a residence and an office. That's all.
This is a wonderful case for Satish ji to think about, to see how to bring about a Ayush chair in Canada, perhaps in Toronto, because you have done so much work already. Perhaps Satish ji, maybe you have thought about this already, and maybe you have some questions for Ishji.
Absolutely. Thank you, Ishji. If you, whenever off the line, please do share if that information is available. How many countries have done the MOU? You mentioned the 2 countries the chair has been placed, which one is Mauritius and which one is the other country? And what other countries done the MOU? That would be very helpful when we are talking here.
Okay.
Ishji, I also want to ask the same question that Satish ji is thinking about and that Harish ji asked to Ashlesha ji from Chicago. Ashlesha ji, I don't know if you want to quickly add something about the opportunity for a Ayush chair in the Midwest of America. Have you thought about this? Are you in discussion with our consulate?
So in 2019, we had this discussion with Ayush advisor, Dr. Nesri, and unfortunately, further steps were not taken. I was involved in that, and we were supposed to bring Ayush chair in Los Angeles, and university. We were talking with these universities, but somehow COVID hit and things got, how things were stopped. But this is really a very good, I'm so glad that Dr. Ishji is here and we are discussing all these things so we can restart the process to bring that again. And this is really a wonderful opportunity also, that how Dr. Ishji mentioned that this is how the Ayurveda can become more established at the top level. So absolutely, and thank you so much, Madan.
I think this is a good opportunity, perhaps clubbing Toronto. Satish is doing a lot of work together with Chicago, and so that we are not duplicating efforts, and perhaps something will come out of it. Before we move on, Ishji, you have highlighted 3 very, very important points. One, the introduction of a curriculum at the government level, Ayurveda-based thinking to go into primary schools and at all the stages of school. This is a model for all of us to discuss with yourself, and perhaps the viewers online will also want to learn a little more. It's very easy to, for those viewing us online, it's very easy to locate our Ayush chair, Professor Ish Sharmaji in Mauritius. You can just Google, it'll be there. It'll be easy to locate the details. Number two, the second important thing that you said is that how Mauritius is helping establish a global perspective for Ayurveda via the President's Palace. Mauritius, as Ishji says, has only 1.2 million people, the population. On an average year, it gets about 1.4 million visitors from around the world. It has more visitors every year than its own population in that country. And Ishji, together with his colleagues, is brainstorming and looking towards holding an integrative medicine congress sometime this year or later. I don't know if you wanted to tell us something about this. What is happening since we chatted last?
Yes, sir. Because we have been over a very important platform which has got multiple integrative medicine healers, including allopathy, from all over the world. Most of them being from England, and they are into 150th of their weekly seminars. Like, they have been very active for last 3 years, and I have been fortunate to be with them for last 3 months. And I suggested that after talking a lot, we have spoken so much, why not to put it to action? And I invited all the traditional healers to Mauritius for a cross training, because sometimes when I listen to someone from another therapy, I might not be very recipient or very sensitive. I might believe that I am the only scientific person, or other therapies are not good. Allopathy people could be thinking the same for us. Homeopathy could be thinking Ayurveda is not very logical or scientific. So we are welcoming everyone. Like, there are around, we have counted, there are 15 different specialists, all having 20+ years of experience under their belt. And we'll be here to cross-train, to sensitize each other, that see where we come from. These are the evidences. This is our system, might be regulated, might not be regulated today. So that we react more responsibly towards our fellow alternative medicine healers. So this being a big function, so much coming up, there being Christmas holidays coming, the New Year, and before that Diwali, there a lot has to be planned. February is not a good month to visit Mauritius because of cyclones. So we are trying, if God permits, that maybe second week or third week of January is the most suitable. So very soon we'll be having a separate seminar upon this, where we have worked out the quotations as well. What would it cost apart from your aid kit? So yes, sir.
Thank you, Ishji. We look forward to details you will share, hopefully share with us when the program is finalized. Now, in all our discussions, one theme that comes up, especially from Satishji, is the preventive aspects of Ayurveda. And clearly what you are showing us with the school children and starting very early lessons about Swasthavrit and Dinacharya and Ritucharya that you have converted into a curriculum that is for school children, is something that maybe you can share with all of us here in Toronto, so that we can also study this and see how to take it with the governments. The other point that is very important for all of us is this dialogue about you can see on the back here, it says traditional Ayurvedic medicines. And we want to see how this message about the traditional Ayurvedic medicines and that thinking that is evolving in this platform can be taken and integrated into this integrative medicine program that you have, and also discussions with Mauritius in the context of the Commonwealth of Nations. Mauritius is very special because it has a population that speaks Hindi, it has a population that speaks French and Creole, and it is an unusual combination for the world to have Hindi speakers who also are fluent in French. And it's a very strange combination. Maybe Canada offers that, where they are people who speak Punjabi and French at the same time. Maybe there are some people that, these are very important opportunities for bringing the world together. I think, Ishji, thank you so much. For those listening to us, Ishji is not only an administrator and a very strategic administrator, but he's also an excellent clinician. And maybe, Ishji, before you leave us for give space for our two speakers today, we just want your impression. You have so much field experience in Rajasthan, in many parts of India, about Jwara Chikitsa and your own personal experience of use of the formulation we are going to discuss today. I know you always have a story to tell. We look forward to hearing something from you about how this valuable Divya Aushadhi, as they call it, Tinospora cordifolia, and its use that you have seen in Rajasthan and other parts of India.
Yes, Guduchi is like very commonly used, and in Rajasthan, there being like neem trees being rampant, and neem giloy is especially popular, where it is marketed like neem giloy. Beyond Guduchi, beyond giloy, they prefer neem giloy. And when it comes to personal experience, I most importantly rely upon Langhan Chikitsa to begin with. Before telling what to eat, including food and medicine, I tell what not to eat. And although people do experience that they have anorexia, they don't feel like eating, but they still keep eating. Oh, we would fall ill, you know, we'll go weak, we are not well already, we have to eat. That is where this is the biggest mistake we can make. So like a justified fasting until and unless you really feel hungry, this is the first treatment, which is like sometimes the things are too apparent to be noticed. They are like too common, and we are at a risk to miss them out. So then followed by this, normally I would be starting with Trikatu before coming to Guduchi for Agni Deepan. And when there is some state of Agni rejuvenation, when the patient shows no symptoms of Ama, I normally would be going ahead with Guduchi. And then depending upon what system the fever is coming from, like what is causing this particular fever. So, but surely we have got, yes, sir.
Thank you so much, because you have shown our audience the subtleties, the small steps that are very important. Number one, fasting, Langana, is very important for Jwara, for management of fever. Number two, Agni Deepan, you use a special intervention just to bring up the general metabolic status of the body before you administer Aushadhi, which then is digested. Jwara Chikitsa is a very important part of Charaka Samhita. It appears as a very substantial part of the Chikitsa Sthan of Charaka Samhita. And Jwara is considered an important part of the etiology of almost all diseases. If you understand Jwara and understand Jwara Chikitsa, then you are attain a very high standing in your clinical practice. Ishji, thank you for being with us today from Mauritius. It just shows how powerful this technology is, how easily we can connect with the world. Please stay with us, because there may be questions later on from our audience who will be digesting all that you have said, particularly the points about Ayush professorships and chairs, and also the leadership that Mauritius is showing to bring the world together to understand Ayurveda. When we look at Mauritius and the tourism aspects of Mauritius, it's a small country. There are more tourists that come to Mauritius than the population of the country. So every year there are visitors that come from different parts of the world. And it's an opportunity, again, to introduce not only at the political level, but also at the level of just ordinary visitors. The visitors who come to Mauritius come mostly from France or from India or from Germany. There are about 8 to 10% of the tourists who come to Mauritius come from Germany. There's a similar number from South Africa, and about 40% of the tourists come from other parts of the world. It's an opportunity to take this message through university, through the University of Mauritius, through the presidential palace, through the herb gardens that are being established there, to introduce people to the power of Ayurvedic medicine. So with those words, I think we are, if Harish ji permits us, could we go on to, perhaps we can go on to our
Dr.
first,
Tejas,
we go to our first speaker for the day. Tejas, namaskar.
Namaskar, Madan ji.
Bahut bahut dhanyawad. Thank you so much for joining us today. We are very fortunate to have you here with us. And we look forward to learning from you. But before you do this, Tejas, our audience are always keen to know how these learned people, what inspired them to come to Ayurveda, particularly our young audience want to see role models, and they want to feel and learn from our speakers about why they got excited to come to Ayurveda. So we would love to hear a little bit from yourself before you teach us a little more about this wonderful formulation, Guduchi Ghana or Samshamani Vati. And perhaps we learn what is the difference between these two and learn a little more. Thank you.
You have touched the core of my memory, Madan ji, and I'm tempted to say it in a big way, but with the time limitations which we have. In short, we are a lineage of Ayurvedic physicians. My grandfather, my father, my uncle, my aunt, my sister, we are all into medical profession, especially Ayurveda. And from childhood, I have been seeing Ayurvedic preparations being made at my home, it being worked out, the patients calling up my father, my grandfather, and praising the treatments. So maybe I was 4 or 5 years, and it so happened that I was in my, after my bath, I was without any clothing. And one of my cousins was chiding me, "Arey, you shame, shame." And I raised my hands and said, "Nature cure Jindabad." So maybe from the beginning, something was embedded in me where I never thought I will go into some other pathy or some other line or some other profession. Medicine, Ayurveda was something which was engraved in me. So I don't see myself being able to do something else. But all said and done, I think we have some time constraint. Unfortunately, the topic today, I remember my teaching days, and this topic, one pharmacological preparation, we used to take around a week or 10 days each one to teach in our classes. So if you allow me, let's enter the subject. We have 2 speakers, rather than going into my memory and taking up everybody's time.
Yeah, the floor is all yours. Thank you for sharing how you came into this and your family connections with Ayurveda, which is always a very powerful introduction to Ayurveda. Thank you so much for being with us, and we look forward to learning.
Very kind. Harishji, you are helping me out with the screen, Harishji. Before beginning, I'll take one permission from you. I'll call everybody my friend, because today we are all like co-students of Ayurveda. We are in the same class learning Ayurveda. So let us be friends and let us enter the subject. I bow before my revered and seek their blessings. I need to thank the organizers. When I saw the list, 9 organizing which are coming together for this series, something which is, I had a few experiences of organizing series, and 9 coming together is a vast thing. I'm highly obliged with everybody to have this sessions, highly obliged. Thank you for making me a part of it. My subject today is pharmacological and therapeutic effects of Samshamani Vati. I am Tejas Kanubhai Maun. I've done my MD in Ayurveda, and let's enter the subject. I was going through the WHO website, and there is a specific mention of 10 threats to global health in 2019. And even today, this threats stand true. Means you can read this, and I have chosen 5 of them. The first one, and a very major one, antimicrobial resistance. The second slide also highlights antibiotic resistance, the same thing in a different terminology, where we are into 4th, 5th generations of antibiotics. And these days, the newer generations of antibiotics, their lifespan, their resistance span have shortened. The next one is, as we just, my colleague and much acknowledged person, Dr. Ishji said, NCDs, non-communicable diseases. One more, I have chosen 5 of the points, Ebola and other high threat pathogens. Next one, please. Weak primary health care. Dr. Ishji very rightly pointed this to us. And the last one would be the present one, where Samshamani Vati came much into limelight, this global influenza pandemic, though this one would not just be limited to COVID, but beyond that also. So are we predicting a doomsday for health and wellness? If these are, you see, WHO is a worldwide organization, and research on medication, research about health is being spent in billions and trillions of dollars. So if it itself is pointing these 10 markers, out of which we have seen 5, are we into a doomsday prediction? Is health and wellness going to crash? Or is that a hope? There is a hope. The hope is with Samshamani Vati. Specifically, I'll come to that part later on, but I consider it as a Rasayan therapy. Rasayan, in a simplified Hindi language, would be chemicals. But here we are not talking about chemicals. This is an aspect of Ayurveda, which I'll be coming later on. I'm not going to elaborate here, which is in a totality a whole new concept of treatment. My next slide is going to highlight what we have been describing. Okay, there are 2 variant formulations available of Samshamani Vati. The first one is Samshamani Vati, which also is being marketed at times as Samshamani Vati number 1. But that is not a necessity. The regulators do not insist that the Samshamani Vati should be marketed as Samshamani Vati number 1 if the formulation is uniherbal, that is the aqueous thickened decoction of Tinospora cordifolia, the Guduchi plant, which we have been talking about. And here I will just add one thing. Dr. Ish Sharma mentioned neem giloy. Giloy is a climber. So the giloy which climbs on the neem plant, that has specific better properties than any other giloy or any other Tinospora cordifolia which grows elsewhere. So this number 1 formula, or the Samshamani Vati, which is available, this is a uniherbal, only one herbal ingredient, giloy, and has 3 polymineral ingredients as oxides of iron, that is loha, mica, that is abrak, and copper pyrite, that is suvarnamakshi. The second one, the second Samshamani Vati, would be marketed as Samshamani Vati number 2. 3. Why 2 has been missed, I don't know, but the marketed part is number 3, or even Balaguti. But the easiest way to recognize this in combination is Guduchi Ghana. Guduchi, the main ingredient, it is just a single herbal formulation of Tinospora cordifolia plant's stem, where the decoction is prepared, decoction is filtered, and the filtrate is again boiled with a very mild flame and thickened down to the basic vati, the basic herb or the basic medicine. Next slide, and I'll come to the procedure of its being made. The therapeutics of Giloy Ghanvati, I'm going to stick not to the aspect of the first one, that is uni-herbal and multi-mineral, but I'm going to stick to the second aspect. But the therapeutics are common to both. So let me take this first, and then I'll go to the description why I'm going to limit myself to the uni-herbal formulation rather than the uni-herbal multi-mineral formulation. So therapeutics, as it's mentioned, we have been speaking Jwara Chikitsa. Jwara can be roughly translated to antipyretic, but the concept of Jwara, and as Dr. Madanji rightly pointed out, Jwara stands to be the first chapter in Chikitsa Sthan after the Rasayan chapter. And if it was not important, if only fever was to be considered, the Shastrakars wouldn't have placed it, but that would be a topic which would not be for today, maybe some other day. So, Jwara Chikitsa, as of Ayurvedic formulation, my personal take, would Samshamani Vati work in bringing down the Jwara? Not on immediate basis. Dr. Ish rightly pointed out that till the Agni, till the digestive system is not controlled and rectified, Samshamani Vati is not the medication which you could think to bring down your fever. But all that said and done, it works miraculously in chronic fevers. It is considered as a sign. That is my second point. And I have not mentioned the names akin to the names which have been tried and tested for therapeutics of Samshamani Vati. It's Madhumeha, Pandu, Kamala, Amlapitta, Grahani, Kustha, Jirna Jwara, Vishama Jwara, Trishna, Daha, Shula, Yakritavikara, Amvat, Vatrakta, and Kastarta. I'll very roughly translate them for the people who would not be familiar with these words. Madhumeha can be said akin to diabetes, although Madhumeha would, if we go into the keener understanding of Madhumeha, it might even go beyond diabetes. But diabetes, Pandu would be anemia, Kamala would be jaundice, Amlapitta would be acidity, Grahani would be your irritable bowel syndrome, Kustha would be skin diseases, Jirna Jwara, chronic fevers, Vishama Jwara, little bit different than chronic fevers, and in acute stages. Vishama Jwara would be more acute fevers, Trishna, the thirst, a specific condition which as a disease and as a symptom appears in many conditions or many diseases. Daha, the burning sensation, Shula, the pain, Yakrit, liver problems, Amvat, arthritis or rheumatism, and Vatarakta could be akin to gout, Kastarta, gynec problems, especially menstrual problems. But my highlight for Guduchi, or my take for Guduchi, is for its immunomodulatory effect and anti-inflammatory effect. Why immunomodulatory is something I'll come later on, but that is why it came into limelight during this COVID-19 infection period, where it could modulate COVID-19. If you are familiar with the patient dying in later stages of COVID was because of excessive response of your immune system. Your immune system used to destroy your lung cells. But again, a very big point, not able to fit in my time frame, so we'll take it some other day. or in question answers. So we need to appraise and select a precedence on what type of Samshamani Vati to choose. Both are there, both are mentioned, both are showing very good results. So do we choose uniherbal multimineral combination? Yes, we can choose, but they are very disease condition and the Rugnabal, that is the digestive power as well as the energy of the patient. So very specific combination to be given in very specific situation, and that is why it needs to be constantly monitored by the physician before being dispensed, just as a Samshamani Vati. A physician has to see to it that if this formulation is dispensed to this patient, his patient, then he has to have a very particular criteria for it to be given, whereas the uniherbal formula is like a blanket medicine. You dispense it, you are bound to get some benefit. I'm going to come to that point. In my take of Samshamani Vati, this is what I'm going to say. Uniherbal formula, you have a miracle in your hand. So be aware what you are prescribing. The dispenser, the chemist, or the place from where it would be given, you ask your patient. This is what I generally do. You ask your patient, please bring back the medicine, let me have a look at it, and then start. Anyways, going ahead, very nice analogy. I read many a times explains things in analogies. And I won't go through the whole story, but Tinospora cordifolia's origin is said to be at a place where the nectar, Amrut, fell on the ground. Amrut fell on the ground in that story, and from there, there was the growth or germination of Tinospora cordifolia. Ayurved's analogy, I personally take it as if it is like nectar, it is like Amrut. One of my botanist friends said, no, this analogy could be said because Tinospora grows without dying. It regenerates by itself. You don't need to plant it or seed it specifically for it to grow. It will grow. That is why it could be the analogy where it is considered as germinated from Amrut. But I disagreed with him and he agreed with me. If it was the Amrut capacity, that is non-dying capacity of Tinospora cordifolia as a Amrut specific drug, then weeds and grass would be more akin to that kind of technique. To kill weeds is a big problem for farmers. So here, keep it in your mind. Just imagine Amrut, nectar, and Tinospora cordifolia. I came with a research paper, and here the importance, though it was done in Bangladesh, but the importance of Tinospora cordifolia was highlighted. My next slide would show. Next slide, please. Okay. It is antioxidant, antimicrobial, anti-HIV, analgesic, antifungal, anti-proliferative, anti-epileptic. Guduchi, this also covers just a little bit of Guduchi's action. It goes beyond that. Next slide, please. This is what I dispense as Guduchi Ghana at my consulting. It is a very simple, you see the charm of preparation. You take Guduchi stem, because Guduchi stem has been understood to have more better ingredients. I'll stick to this, the earliest slide. Guduchi stem has more better ingredients rather than the other parts of Guduchi, but Guduchi's whole plant is also used. So Guduchi stem, it is made into a decoction, kadha. Decoction is 1 part of the base ingredient, 4 parts of water, boiled down to 1/4 part, then it is filtered, and the filtrate, the liquid, is again slowly boiled. This could be very well understood if somebody knows how jaggery is prepared. Good. Jaggery is prepared when the cane juice, I have seen around 10 foot long skillets, and the cane juice is poured in it, and then gradually it is heated and boiled, and the thick part of the cane juice is good. Same way, Samshamani Vati is prepared, and very simple to prepare. It could be done at home in a very small level. It could be done in a very big, grand level at companies. We'll go to the next slide, please. A question: why uni-herbal formula? Because what I have seen is, one, the quality control of minerals is a very big question mark still in Ayurveda. So if uni-herbal preparation of Guduchi, the second one which I said, only the Guduchi being used in forming Samshamani Vati, it is a blanket. You give it to your patient. The worst it could do is it won't give you any action, but there would not be any negative part from dispensing this medicine. So I, in my practice, only use uni-herbal preparation, although it is not because I use the other is not right, the other is right, but it needs more specific conditions to be dispensed. My next slide is a paper from Sri Lanka, whereby why this uni-herbal preparation of Guduchi? Because Ayurveda mentions in juice form, in decoction, that is kada form, the boiled extract tea, let's say tea of Guduchi, would be more potent. Because this paper has shown, there is a graph which unfortunately on the screens might not be clear to read. The next slide, please. One of the prominent aspects of people choosing between the Western system of medicine and Ayurvedic system of medicine is the taste. And believe me, my friends, Guduchi is one of the bitterest tasting medications. So juice of Guduchi or tea or kada of Guduchi, the decoction of Guduchi, is not going to be palatable, as well as you get a longer shelf life, you get a more potent, more potency in a lesser quantity. Next slide, please. Yes, the Guduchi Ganvati, if you see this paper, it, as I mentioned in my earlier slide, where I said anti-inflammatory property and Rasayan property. So this is a paper which describes, and it has clearly proved, that yes, you take Guduchi and anti-inflammatory property is seen very properly, very clearly. And cancers, the first criteria of cancer generation is long-term inflammation, intracellular long-term inflammation, and cancer are being seen to occur. So anti-inflammatory property of Guduchi is something which we have to keep in our minds, which needs more keen provocation and propagation and observation, and to be studied further. Next slide. Yes, Rasayan impact of Samshamani Vati. Now, understanding Rasayan in a very simple words is chemicals as per Hindi understanding. Rasayan in Ayurveda is a whole new concept. Like in Western medicine, you have general physician, then orthopedics, then gynecologists, pediatrics. Same way, Ayurveda too has 8 different kinds of specialization. One of them is Rasayan. This paper of Rasayan, which commonly understood, Rasayan anti-aging. But when I went through all the papers on Rasayan, these are the points which my next slide will show. Rasayan has a promotive treatment, has an immunity boosting treatment, has a regeneration treatment, has a geriatric treatment. Geriatric, the anti-aging or treatment for people who are on the older age side, as well as this I came up with a few papers. The second part I came up with other few papers. So antioxidant action, immunomodulatory action, and all the 8 actions have been studied, documented, and put up in the research papers. So Rasayan is something in Ayurveda which is very, very promising, which is very, very fundamental and basic, not just for cure and treatment of diseases, but even as something to stop formation of diseases. But maybe some other time. My next slide, my take on Samshamani Vati or my experience. Now, I'll stick to my Samshamani Vati slide. So what has happened is I consider Samshamani Vati beyond its known therapeutic actions as a Rasayan, and it is not my conclusion. Rasayan properties of Samshamani Vati are mentioned earlier. And this is what had happened with me when I started my practice. And I used to have my patients in front of me. They started narrating their problems. In my mind, I'm listening to their problems as well as deciding and concluding what medicines I'll be dispensing to them. So they are narrating their problems. My mind is going on 2 criteria. Okay, these are the problems, these are the medicines which I would be prescribing to them. And at the end of their narration, they used to add, okay, doctor, we have tried these medications, but unfortunately, nothing has worked with us. Or although it worked with a very limited aspect. And here is something which came to me during my cancer thesis research. Okay, when we were working on cancer treatment, we found out Rasayan drugs do work on your cellular level, the Dhatu Agni. This is a concept which needs elaboration, but the Dhatu Agni concept can be very nicely understood with your mitochondria of your cell. Your cell has an energy space where energy is produced in your mitochondria, and Dhatu Agni concept is something akin to that intracellular activity, and Rasayan are the best drugs which work on them. And I found Samshamani Vati to act as a Rasayan. So I choose 5 medications for a particular case and add Samshamani Vati. And I'm very clear with this. I add Samshamani Vati to 50% of my patients, and 2 results I get. One is more action than what earlier taking the same medication gave my patient. 2, the best action which I have seen is they don't come back with their problems. The recurrence becomes so less that they, rather than coming back to me, they send their relatives, not for themselves, for the relative problems. So recurrence part, if you use Samshamani Vati in some way, the uni-herbal formula, which is not going to harm your patient in any way, or it is not a specific criteria of a disease where you need it, you are bound to get extra results. Try it out. Simple. My next slide, although not directly in the subject, but Samshamani Vati has effect on your mind also. In epilepsy, where I have seen where there is a swelling, Samshamani Vati also controls your epileptic fits. Ayurveda has a very clear understanding of healthy person, a well-being or a health of a person. It is in 2 lines. I will narrate it in Sanskrit. Samadosha, Sama-agnischa, Samadhatu, Malakriya. The first line, it mentions your bodily aspects. I'm not going to take more time in explaining the first line. The second line, Prasanna Atmindriya Manaha Swastha Ityabhidhiyate. the first 4 words, prasanna, happy state, atma, indriya, manaha. Ayurveda would never mince words. The sages have been very particular with the wordings. If it wanted a shanta mana, a plain criteria of mana, it would have not entered the word prasanna in it. So happy state of mind is what is making us healthy. So be happy. And as we are on an international forum, my next slide is thanking you all in all the language which I could think of. Thank you for your patient listening. Thank you, organizers, for making me a part of the great sessions which you are conducting. Thank you.
Tejas, thank you. Thank you very much for sharing so many important insights, many insights that come from practice. And you are fortunate, as we said earlier, you have a family tradition that runs through generations. And there are many things that are gifted to you by your interaction with your ancestors, with your parents, your grandparents. And you thank you for being with us and sharing such wisdom, particularly that aspect that you mentioned about giving Guduchi Ghana and seeing responses which you may not see if you didn't give Guduchi Ghana. And these are simple things that are important sometimes to provide confidence to a young practitioner. The evidence that you gather from generations of practice, like Harishji here with us, also very privileged to have these kind of benefits. Thank you for being with us. Please stay with us. There will be questions. For those who are joining us online, please share your questions, comments on the chat box. There is an option here. For those who are joining us, who are not here on the Zoom platform, but joining us online, I wish you will join us on the Zoom platform so that you can interact with the speakers and ask your questions and share your comments. Perhaps we should move on to our second presenter today before we take questions and go to our discussion section. We welcome our second speaker who's joining us from the state of Karnataka. Shreyas, namaste. Thank you for being here with us. A question that is already coming up. We want to hear a little more from our second speaker also, how they got involved in Ayurveda. What was the motivation? Why didn't you go and study modern medicine? What inspired you to stay in Ayurveda, and how you continue to be inspired by Ayurveda? Welcome to the platform. Thank you for joining us today. And thank you for sharing your time and hopefully your insights into this formulation. Namaskar.
Namaste. Thanks, Professor Dr. Madan sir. Greetings of the day to all of you. To answer the question which Dr. Madan sir has put, in fact, it was by chance to get into Ayurveda, not by choice earlier. But then after coming to Ayurveda, got to know the varied benefits of Ayurveda, where it approaches you holistically, not in a single route, where you can go deep down the disease and permanently have a solution for something. So that was the thing which fascinated me, and that is how I started my inclination towards practicing more of Ayurveda from there till now and in future also. So this is about it.
Thank you for being with us today, Shreyas. We look forward to learning from you.
Yeah. Okay. At the outset, I would like to express my gratitude to Vaidya Harish Vermaji for giving me this opportunity to share my views on Samshamani Vati, also to all the guests who are present as panelists there. So I'll be sharing the screen.
Thank you, Shreyas. We can see it very clearly. Thank you.
Yes, thanks. So therapeutic effects of Samshamani Vati. So I am a consultant Ayurvedic obstetrician and gynecologist, also an associate professor at Karnataka. So as Dr. Tejas was mentioning, that we have two different yogas of Samshamani Vati. One is a uni-herbal and second one is a mineral origin one. So here, when we see the Samshamani Vati, which I am talking right now, would be of the reference from the Rasatantra Sara, which is a text also called as Siddha Prayoga Sangraha, wherein the reference for Samshamani Vati was from Vaidyaka Chikitsa Sara, which is a Gujarati Grantha. From there, we get the actual reference for the Samshamani Vati. So let's see what it basically has. It has the Guduchi Sattva, that is the starch which we get from the Tinospora, around 10 parts, for which we add Abraka Basma, which is incinerated mica, Loha Basma, iron oxide, incinerated iron, and Suvarna Makshika Basma, chalcopyrite, half part. So together, this combination would be made into a tablet form, of each tablet around 250 mg. And this is indicated, this is generally prescribed as 2 tablets BD or 2 to 4 ranging. And the Anupana, ideally, it would be advised to give this medicine with milk, if not warm water. So this will be the general prescription of how we give the Amrita, the Samshamani Vati. So here I can share you how the Guduchi Sattva, the Abraka Basma, the Loha Basma, the Suvarna Makshika Basma, finally coming the output as Samshamani Vati. So my domain, basically, I am a gynecologist, obstetrician and a gynecologist, a Prasuti Tantra Stri Roga Tagnya. So my domain would be more of OBG, and I would be highlighting today in obstetrics and gynecology how useful our Samshamani Vati can be. So this is generally, we have seen the Samshamani Vati being popularly used, especially in fevers and in COVID-19, which actually made the world look into Samshamani Vati. So generally it is given in all kinds of fevers, but we have other conditions which are more like in obstetrics and gynecology, how well we can start prescribing Samshamani Vati. So general indications of Samshamani Vati we have seen. So these are in Jirna Jwara, chronic fevers, in Kshaya or tuberculosis, Pandu, anemia, Kasa, cough, Pradara, menorrhagia, Dhatu Kshinata, debility, and Durbalata, weakness. Now let's see how useful this Samshamani Vati will be. Basically, it increases the strength, overall strength. The ideal, it is generally ideal for Pitta constitution, the Pitta Prakriti persons, for Klesha Ashishnata, those who are very, those who can't tolerate more of stress to their body and strain for them. It can be given in Sagarbha, Garbhini, Sutika, and Bala, which means it is, you can give it in pregnancy, after delivery or in puerperium, and also in children. It basically strengthens the nerves, muscle tissues, ligaments, glands, and brain. It also improves the memory. It builds up or nourishes the depleted tissues. It treats chronic fever, and it regulates the digestive system. It is the safest drug in pregnancy and lactation. All ages, irrespective, from children till old, can use it. It is excellent in cases where fever resides in dhatus and spreads slowly. So at the tissue level, at the dhatu level, if there is fever, there it works. It is useful in radiating pains of upper limb or lower limb, beneficial in insomnia and heaviness in head, and it enhances both physical and mental strength. So these are the varied uses of the single Samshamani Vati. When speaking about my domain, Prasuti Tantra and Stri Roga, it can be started well before conception, that is in preconception. Those couple who are planning for a pregnancy or infertility treatment, there are certain conditions, like for example, idiopathic infertility, where all factors would be normal. In spite of that, pregnancy is not happening. There, this Divya Aushadhi can be utilized. So this starts from preconceptions, that is Garbha Grahanartha. The basic thing, the mode of action is it modulates your immunity, immunomodulator. It helps in bringing up a good kshetra for the bija and also improves the quality of the bija, the gametes. So Garbha Grahanartha. So it starts working from there. And in case, in fever, in pregnancy, especially, pregnancy fever is something which most of the people would be worried of taking some antipyretics, antibiotics. There, in such cases, this can be used very safely. In cases of candidiasis or monolial vulvovaginitis, which is most commonly seen in pregnancy. Pregnancy, we call it as upapluta yoni, where in pregnancy there is increased infection of the genital tract, where those infection, if not treated appropriately, can cause various other complications, like it can end up in chorioamnionitis, causing premature rupture of membranes and preterm labors. So there, in such cases also, in case of upapluta or infections in pregnancy, vaginal infections, there this will go very ideal. After delivery, there are after pains, which we say, or sutika makkala, severe pains would be there because of the contraction and retraction of the uterus physiologically, and the uterus tries to expel all the products which were there. It comes out as lochia, which we call as lochia. So during those conditions, if there is some infection, then there it helps. So sutika makkala. In case of puerperial pyrexia, if there is puerperial sepsis, which can cause fever after delivery, there again the concern comes of lactation. Well, this antibiotic or well, this antipyretic, is it safe for me to use? So that there this again works. Sutika Jwara, Sthanyotta Jwara or Stanavidradi, especially when they are breastfeeding, if there are any breast complications like breast abscess or something, there also this has its role. When coming on to gynecology, we can start thinking of writing this in our prescriptions, especially in acute infections of reproductive organs like Pittala Yoni Vyapat or Pittaja Yoni, in Sannipataja Yoni, acute infections of reproductive system. So generally when we see in acute infections, most of the patients, whoever comes for an Ayurvedic approach, would have gone many other doctors where they would have taken many antibiotics, painkillers, antispasmodics, because of the fever, many antipyretics. There, in those conditions where they couldn't find cure, they can come here and start using Samshamani Vati. Why? Because this acts at the tissue level. The basic mode of action will be at the tissue level, thereby decreasing the infection, because it starts acting on the microorganisms, decreases the infection and modulates your immunity, builds up your immunity. Your immune system would be so very strong, it will not be easily affected by the infection again. So there it starts working. Inflammation of reproductive organs like Paripluta Yoni Vyapat, in that cases. Also in abortions, like if there is history of incomplete abortion or septic abortion, if there are remnant products, then like Raktaja or Asurja Yoni, which we could correlate with, in those conditions. Kaphaja Yoni Vyapat, again, Trichomonas vaginitis, vaginal infections. In Kaphaja Yoni Vyapat is a gynecological condition. In fact, there, this can be used. In Pittaja Pradara, menometrorrhagia, especially due to pelvic congestion. In this kind of pradara or menorrhagia, there in pelvic congestion would be more. So there, this menorrhagia turns into menometrorrhagia, where the bleeding would be too heavy, severe and too heavy bleeding, which can land up in Panduta or anemia. So this Samshamani Vati can help in managing this Pittaja Pradara, Kaphaja Pradara in chronic endometritis, in Shweta Pradara or leukorrhea, in pelvic cellulitis, Pittaja Artavadushti, in chronic endocervicitis, Kafaja Arthavadushti. So these are few gynecological areas where Samshamani Vati therapeutically can be used in. There are other few areas like early stage of endometrial cancer, which could be considered as Raktaja Arthavadushti or Kunapagandhi Arthavadushti. In these conditions, early stages, and after surgical treatment in gynecological cancers, Arbuda Chikitsa, like post-surgery or during chemo, radio, post-chemo, post-radiotherapy. In fact, there the Samshamani Vati helps in immunomodulating, and this will also help there in Arbuda Chikitsa. Also in Rajonivrutti or after menopause. So there will be depletion of all the tissues. So there, to strengthen the tissues, this acts as nectar. So here I would like to share a few research on Samshamani Vati. So we all know that COVID-19, we've got a lot more research papers there, and we have seen the immune modulator effect of Samshamani Vati. So we also have papers of Samshamani Vati as antipyretic, antibiotic, antimicrobial, and anti-inflammatory. So here are a few papers where in COVID-19, a prospective open label controlled interventional study on the effect of Ayurvedic intervention, that is Ayurveda Raksha Kit, as a prophylactic measure in the pandemic of COVID-19, a community-based study. So there is one paper, and another paper where it is like impact of Ayurvedic formulations in standard care of COVID-19 in tertiary hospital at Gurugram in India. Even there we have one paper on a pilot study with Guduchi and Pippali, which was conducted by the Transdiscipline University. We have an article at BMJ also, that is a retrospective study of efficacy of safety of Guduchi Ghana for COVID-19. And again, in COVID-19, we also have another paper like a pilot clinical study on add-on Ayurvedic formulation containing Guduchi and Pippali in mild to moderate COVID-19. And we have another paper of Guduchi Ghana, a retrospective study on efficacy and safety of Guduchi Ghana for COVID-19 asymptomatic patients. And as an Guduchi Ghana to improve the immune status as an immune modulator, especially in at high risk of COVID-19, there we have another clinical trial. The other compounds which are used in the Samshamani Vati is Abrakabhasma, Lohabhasma, and Swarnamakshika Bhasma. So Abrakabhasma is an amorphous powder drug which is prepared by treating the biotite or mica with the juices of number of reconstituent plants that make it more powerful regenerator. So according to research, one research I have taken here, that is to study the effect of Abrakabhasma on hematological and biochemical profile of viscerats. So here the findings indicate the erythropoiesis stimulant action and also a significant phagocytic activity, that is immunomodulatory activity of this bhasma. So it helps in Pandutha in improving the debilitated tissue by improving the hemoglobin by erythropoiesis stimulation action and also phagocytic. So it also helps as an antimicrobial there. So here another paper on Abrakabhasma as a nanomedicine. So it states that it inhibits the growth of yeast cells. So this bhasma will in fact inhibits the growth of microorganisms, especially yeast. So here there is this literature which is pertaining to that according to this International Journal of Pharmaceutical Science Review and Research. So when talking about Lohabhasma or the iron ash, it is one of the iron-based herbometallic preparation used in Ayurvedic medicine for treating various elements due to iron deficiency. It is used in treatment of anemia, hyperlipidemia, tuberculosis, UTIs, obesity, and so forth. So this is the paper which gives the validation for this. So antibacterial activity of Lohabhasma against various bacterial pathogens. So even Lohabhasma is used here, and it is found strong antibacterial against Salmonella typhi, S. epidermis, S. paratyphi B, aureus, vulgaris, pneumoniae, etc. So this is another literature which we can present for the antibacterial activity of Loha Bhasma. So the last one being the Swarnamakshika Bhasma, which is an Ayurvedic medicine which has all nutritional benefits of both copper and iron. So in addition, it is also an important therapeutically in the treatment of anemia, jaundice, insomnia, chronic low-grade fever, burning sensation in the eyes, heartburn, burning micturition, bleeding disorders, headaches, pulsatile pain and feeling of burning sensation or heat, leukorrhea, and other abdominal diseases. So this is an immunomodulatory effect of Swarnamakshika Bhasma. And this is another paper at JIM, which says that even Swarnamakshika is a good immunomodulator. So with the combination of all this, the Samshamani Vati, which is a compound preparation, which has Abraka, Loha, Swarnamakshika, and Tinospora cordifolia, that is the Sattva, Guduchi Sattva, that is a compound preparation, and a single Samshamani Vati, which is just a Guduchi Ghana Vati. So these two are in the name of Samshamani Vati, and both are very potent and equivocal, whereas Samshamani Vati, the compound preparation, is more with the added on benefit with the effect because of the effect of the Loha, Abraka, and the Swarnamakshika. So therapeutically speaking, this is about the Samshamani Vati. The great thing about Ayurveda is that its treatments always yield side benefits, not side effects. So thank you all for your patience listening.
Shreyas, thank you so much. You have given us the real essence of the study, which is real essence of Ayurveda, which is medicines with side benefits. And particularly this one formulation this one plant that we've talked about that Tejas also mentioned, the bitterness in this compound. Bitter compounds are very important for modulating the immune system. There is an opportunity for a wonderful dialogue between a large number of bitter researchers around the world and the practical experience, the experience over millennia on how these bitter compounds from formulations made from Guduchi and so many other. Andrographis paniculata is another bitter plant that is used. Now, one question that's come through here is about the safety and efficacy of these formulations, because there is a four-letter word called bhasma when it comes to the use of Ayurvedic formulations. People get frightened. They hear this word bhasma and they get frightened. Now, the question that is here is this safe for bhasma? Are these things safe? These are routinely used for thousands of years in India, and perhaps Tejas has raised his hand here. Tejas, it's an open question. The safety and efficacy of this formulation, either as a single herbal thing or in combination with other minerals. Please do comment. The second question is it safe to use in children? Fever in children is a very complicated area. What is your experience on use in children?
I'll answer your first question first. Fever in children. The criteria or the potency to reduce immediately the fever is not very good with Samshamani Vati. I would not say you give Samshamani Vati and you will have a drop in the temperature. But on a long term, and to reduce the recurrence of your fever coming back again, Samshamani Vati acts like miracle. We have been repeatedly mentioning this as a Divya Aushadhi. The basic reason would be this origin from nectar, if the analogy could be understood well. With regards to the bhasmas, the oxides of minerals, Ayurveda mentions in a big way. So we cannot say that no, somewhere the sages were incorrect in mentioning them and the efficacy or the effects could go wrong. But unfortunately, as per my understanding, and I limit this as per my understanding, the processing of the minerals, the preparation of bhasmas, many of the parts is yet to be understood. The ingredients which are used in processing, they are still having a debatable aspect. So
Tejas,
somewhere down the line,
interrupt you here, Tejas. Let me sharpen this question a little more as to why we are asking this question, why this question is important. There's you can see from this platform, there's ongoing discussion with many, the University Health Network, a collection of hospitals in Toronto, and there are discussions going on about research projects. And as Shreyas is correctly mentioned, particularly that area of women's health, there are safe alternatives that Ayurveda offers, as Shreyas has completely convinced us today. Now, is it difficult to develop a research program when we are using certain compounds that people are not familiar with? Number one, what is the evidence you provide? How do you open a dialogue? How do you open a discussion? Do you see the questions running through our minds? You have many generations of Ayurveda in your family. And we are wanting to make a collaboration with people who don't know how Ayurveda might be spelt. There is a challenge. And how do we make this dialogue happen? You know, where do we reach out to people? How do we make this happen? So that's one question. We are very fortunate. So keep this question in mind. Pallavi has raised a hand, but we also are very fortunate to have here today with us Dr. Baswati Bhattacharya, who's joining from New York. Baswati ji, namaskar. Baswati ji is very special. She trained in modern medicine, and she's a public health specialist. She then came as a Fulbright scholar to India, and she did her PhD in the Department of Rasashastra in Benares Hindu University. Baswati ji, namaskar. Thank you for joining us today.
I just have a quick question to Dr. Shreyas, Dr. Madan, if
please,
you permit.
Please.
Yeah.
Please.
Dr. Shreyas, you have extensive experience on Gynae, Prasuti Tantra. So you mentioned about metrorrhagia and pelvic congestion and endometriosis, Kashtartha, dysmenorrhea. So will you tell the dosage and Anupan would you give?
Yes. The dosage generally is 2 TID, 2 tablets TID before food, because when we are treating the gynecological conditions, we generally go with the Aushadha Sangrahana Kala, where Apanavata Dushti is. So in practice, we generally give it before your meals, before the Apana Kala. So it is 2 TID. Depending on the condition, you can also go for 3 if the patient is responding. It is with half glass of milk.
Oh, okay. Thank you.
Because we see basically congestion, menorrhagia, everything is pitta related. So we have to give something which can pacify pitta there. So dugdha or the milk is the best one where you give. And those who are not tolerant to milk, there you can give Ushna Jala or lukewarm water. Yeah. Or else it's
because it is very well known that Guduchi, that is Tinospora, cordifolia, has a very good effect on the cellular level.
Exactly. Right.
Thank you.
Thank you. Pallavi, thank you for asking the sharp question. And also Tejas, thank you for pointing our listeners to Aushadha Sangrahana Kala. And very complicated terms, but very, very important. And that's what makes Ayurvedic physicians so skillful, because they can understand when to use medicines and how to use that to harmonize with the different times of the day when different physiological processes are in action. And that richness is very special. And thank you for pointing us to this. Now, I want to see if Baswati ji will join us. Baswati ji, namaskar. Baswati, are you here with us? Oh, Baswati, we cannot hear you. While Baswati tries to join, Shreyas and Tejas, my question, let me put it this way. We want now, we've heard from you the benefits of this formulation, how wonderful it is, how it is anti-inflammatory, how it helps improve the performance of other medicaments that you offer, how it can be used for women's health, complicated problems which are very common in women's health across the world. Ishji is here from Mauritius. He says there is a possibility of engaging in Mauritius, from Mauritius to the 54 countries of Africa. And there is discussions that Canada, India, UK, Sri Lanka, Bangladesh, references that he used, can all come together to provide a new way of thinking. Is this a difficult area to take forward, or do we have enough of all the pieces required to open a dialogue? Tejas.
This question would be more rightly answered by Dr. Ishji, but according to me, what I have observed in all my years of practice, you give results and people seek you, not just as an individual level. So let Ayurveda prove itself by its results. Let's give situations where people see the impact of Ayurveda, and automatically they will be keen to join us. They will ask us, okay, can you please help us out in this kind of conditions? So what we need to do is, rather than having a mentality of limiting our own personal gains, let us just see to it that we give results without any complications, and automatically the world will come to you. This is what my take on this is, though it's more philosophical rather than a practical aspect.
Ishji, thank you, Tejas. Very, very important, and very important. When the formulation works, when the medicine works, when the practice works, then people gravitate to it. So this is the message. Ishji, is that sufficient enough to convince policymakers to engage in the dialogue we want, that initial dialogue?
Yes, given the Indian background and the Ayurvedic background, we very well know that we have been using bhasmas for centuries with the proven and significant efficacy, and no doubt about it. Might it be heavy metals like cadmium, arsenic, lead, and mercury, but still we have to sensitize the Western world. So for the time being, what I have been trying for last 20 years is I withhold myself when it comes to these 4 heavy metals. I do not pitch them on front foot. And I recommend the other bhasmas, like it could be iron or any other bhasma, which are safe. So I believe we have to sensitize them with what they already accept, because they are not able to differentiate between Shuddha and Vishuddha. There could be a Shuddha mercury bhasma, but Ayurveda makes it Vishuddha, where this is like upon on like nanoparticle level, it does not harm, as because everything is not visible under a microscope. So I believe if we go step by step, we in the first phase, we be on the same page when it comes to non-controversial all other bhasmas, and later on when we can really justify regarding these heavy metals as well, either we agree to them that these should not be given, proven beyond doubt, or we bring them to our page that okay, we have been using for centuries, and all these so-called heavy metals can be very safely used. I believe this can be a like a judicious, like a Confucius middle way approach.
Thank you. Ishji, I hope this is the start of a discussion. We've had this discussion in our earlier sessions, and hopefully we can all come together again just to see if we can shape a research study or something that grows the confidence that we need for this interaction, not only between India and Toronto, India and Canada, but also with yourself now in Mauritius and your engagements with Africa, and hopefully also with colleagues from Sri Lanka and from Bangladesh. They will join us, and then we can have a discussion to see how we can enthuse our colleagues at the University Health Network in Toronto, and also our colleagues here in the United Kingdom, and together form a collective effort to take this discussion onwards, perhaps with Australia too, with our new Ayush professor in Australia who will be appointed soon. So I'd want to see if Baswati ji can add a few words.
Yes. Can you hear me now?
Baswati, thank you for joining us today.
Yes,
Did you want to?
Here. Yes, and just waiting for activation on the panel. So thank you to all of you. Welcome, and thank you for inviting me to say a few words. And Harishji, thank you for requesting me. So I have 3 points to make, but as I was trying to get the audio video worked out, we started talking about heavy metals. And of course, that is where I get activated. So I want to propose that one of the first things we need to do as an Ayurvedic community is stop calling them heavy metals. The heavy metals which are tested are arsenic, lead, cadmium, and mercury. And the fact is that there are many, many bhasmas which when tested only have copper and silver and gold and abrak and some of the Sudha Varga and iron. And these are not dangerous, quote unquote, by the heavy metals, police. So as a community, if we stop calling them heavy metals and just say they are herbal minerals, as Dr. Tay just said earlier, call them minerals, call them, they are elements and they are trace elements. And if you look at the human metallome, they are not dangerous. So that dialogue needs to change on our side, so we don't alarm people by saying heavy metals, because it's kind of a red flag for people who don't understand what Rasa Shastra is. So that might be a first step for all of us. And having said that, I was surprised that no one mentioned the Samshamani Vati, which is made with Gomutra. Now, I don't know if you guys have been told not to, or you don't know about it. Dr. Shreyas is smiling with his eyes, so I think he knows about the Gomutra. But the way that I learned it is that there's Guduchi Ghana Vati, and there's Samshamani, which properly made has been purified through Gomutra. And it's not purified, I know that's a bad word. There's Shodhana with Gomutra. So for those who know the power of cleansing or of altering the Guduchi, this can be the neem Guduchi, and it can also be the Pittal Guduchi. And so that brings me to my third point, that if we talk about, as we are, Samshamani Vati as a formulation for Jwara and for all the different conditions, and also, being discovered or rediscovered during the COVID times, there's a conversation that keeps coming up and then getting dropped out, which is really important for all Vaidyas who know it to continue introducing, and that is Apatarpana Santarpana. Guduchi can be used in different ways for Apatarpana versus for Santarpana. So if we talk to people who are in the modern sciences and they say, well, what is Apatarpana Santarpana? And we're talking about the immune system, there are many different components to the immune system. And those which are doing the work of Shodhana, of cleaning out or of transforming or changing things, which are increasing the Agni. And remember, Agni does not mean fire. Agni in Sanskrit means that which consumes. So when Dr. Tejas was talking about mitochondria, that was beautiful, because in the mitochondria, we consume, we take one, I'm going back and forth between Ayurveda and modern medicine, but in biochemistry, we talk about the compound that goes in and then it gets consumed, transformed by the CYP-A34 enzyme, or by the, different, what can we say, enzyme complexes that are on the inner wall of the mitochondria. That transformation, that Agni that we are talking about, if it's doing the action of cleansing, it's Shodhana. If it's doing the action of rebuilding those structures which need to be rebuilt in the cell biology understanding, then that's Santarpana. That's more of the Rasayana that he was talking about. So if we can separate the Shodhana herbs from the Rasayana herbs and not mix up their actions, we don't need to give khichdi when we're giving medicines. And when we come to Guduchi, Guduchi has activation properties depending on the herbs that it's with. And I'm saying this as a clinician, I'm saying this as a pharmacologist, and I'm saying this as a Rasa Shastra person. What I'm conceiving is that the Guduchi, which has Shodhana properties, first needs to be given in the first part. So in COVID, it's the people that need the purification, the cleaning out of the phlegm, the cleaning out of the toxins that are there, whether they're Garavisha or Visha from, if you think about COVID as being an external, whatever, and a virus. And if you then add in at the same time a rasayana, you're not going to get the Shodhana effect. It's like trying to scrape the walls in a house and clean off the old paint, and someone else is putting a fresh coat of paint on at the same time. Everything is going to go garbar. You need to clean off the old paint, clear that out of the room, clean the area, and then put on the new coat of paint, which is what rasayana is. So putting ashwagandha, which is a great rasayana, at the same time as, let's say, Jayamangala Ras, that's why it wasn't working. And every clinician knows that you have a phase 1 and then you have a phase 2. So I just want to remind people at the Apatarpana Santarpana, I learned this in Karnataka with my teachers in Udupi, and they're very clear that you don't want to mix them and that you want to have phases of treatment. And I hope you will forgive me for going back and forth between the modern immune system and the biochemistry and the Dhatu Dosha principles. But I really think that we need to be thinking about Guduchi as doing different actions depending on different compounds that it's with. So with the Gomutra, it's going to have a different set of actions than it is with the formative metals like Tamra Bhasma or Swarnamakshika, and that we must not get those mixed up and do this silly talk about standard operating procedure or standard formulation, because those formulations are for different purposes, and you can't just say there's one Samshamani Vati.
Thank you, Baswati. Thank you so much for quickly joining us today and sharing your thoughts. We are fast approaching the end of the time allocated for us. And this is more than a taster that we promise you. You have seen from our speakers, our presenters today, the level of skill they have in practice, how they understand these complex formulations, how they understand the subtleties and the strengths of these formulations, how they use them in gynecological conditions or for management of fever, or as Dr. Baswati Bhattacharya says, to use it in different ways to either manage aspects of Agni, as a rasayana aspect, or as a booster of the immune response. There is, Harishji, there is only one last question left about what are the side effects of this formulation on autoimmune diseases. This is a very deep question. I leave this with you. From my side, I thank all of our speakers. Ishji, thank you for joining from Mauritius. Tejas, thank you so much. You are part of the team. We will come back to you. And Shreyas, thank you for joining us from Karnataka. Baswati, thank you for joining us. We'll come back to you because one of the wishes is that we frame research initiatives, programs, clinical studies for the future to win that confidence so that Ayurveda is appreciated more. And this series is aimed at that. I finished there. Thank you so much, Harishji. The last question, perhaps you can raise it. The question about Guduchi and the autoimmune response, whether it increases the autoimmune response, whether we get unwanted side effects. I leave it with you. Thank you.
Sir. Thank you, sir. Thank you very much. And Dr. Madanji, it was not mine question. Basically, there is an article published on PubMed by the liver club hepatologists in India. They observed that during pandemic, many people consumed Tinospora cordifolia extract, and they observed liver injury. Their enzymes got raised, and it was observed in patients suffering from autoimmune hepatitis. Now, I have a question to all the experts here. Can Guduchi be used in autoimmune diseases? My first question is to Dr. Ishji. Dr. Ishji, can Guduchi be used in autoimmune diseases, or can it aggravate autoimmune disorders? Because Guduchi is a very powerful stimulant. If you look at the management of autoimmune diseases, in modern medicine, they suppress the immune system. But if we stimulate the immune system, is it possible that immune system may start producing more antibodies against the organ, and it can cause further damage to the organ whatever the organ is involved, maybe the skin, maybe the liver, maybe the kidney. There are many autoimmune diseases like multiple sclerosis, like ulcerative colitis, like Crohn's disease, or even vitiligo, psoriasis. So is it possible that any disease, particularly autoimmune disease, can be aggravated by consuming powerful stimulant like Tinospora, cordifolia? Thank you, sir.
Sir, my little experience, the commonest autoimmune disorders which we normally handle is rheumatoid arthritis and systemic lupus erythematosus. In such patients, we have been after Shodhana, we have been after Vata Kapha, Shaman Chikitsa, we have been giving Guduchi. And I believe this might not be triggering those like a particular immune factors which would directly be like ensuring more attack or more damage to those target tissues which are under attack in that particular autoimmune disorder. So, but this really warrants a much bigger and much specific study. Like, can giving Guduchi be directly boosting up some parameters, and which we can really substantiate, which we can prove? In speaking generally, whatever my experience has been, I did not find Guduchi to worsen, as this has been like one study by the Liver Club Association, the liver experts from India. I don't know what what was their parameters and how did they come up with it. But normally speaking, personally speaking, I did not find. Rather, I was waiting when could I start with the Guduchi after Shodhana, especially because the commonest being the rheumatoid arthritis. In those females, when we could put them on Guduchi. So I did not actually experience any negative effects even in prolonged use when they have been on this for like 2 years, 4 years, 10 years off and on. So, but really maybe I could have to introspect deeper on this particular parameter if those those factors could be worsened and the attack could be made more severe with the regular consumption of Guduchi in abstract form or whole form. But by the way, by chance, I never used extract forms. I used whole herbs only, which could be having some natural counterbalancing principles. That is where our phytomedicine doesn't become a phytochemical medicine, because 80% of the Western medicines come from the plants. But the difference is, why do they have a very sharp effect and a sharper side effect? Because those are like with like over smartness, with this human over smartness, we separate the active principles, and that is where they are. They have their pros and they have their cons as well. So surely, like you have given a new insight. So this should be undertaken more scientifically so that we can really reach to this conclusion. What does it actually do?
Nisha, thank you very much. I think you are right, because in market nowadays, hydroalcoholic extract tablets or capsules are available. However, our acharyas have not used hydroalcoholic extract. This is a very important point. Our acharyas used only aqueous extract. They used Ghanvati. But in market nowadays, the hydroalcoholic extract is available. So maybe there is a possibility the alcoholic component which we draw from the Tinospora cordifolia stem may be causing some damage to the liver disorder. So there is a possibility. But if we look at our original text, our acharyas, while making Guduchi Ghana, it is made by boiling Guduchi stem only in water, not in alcohol. So there is a possibility. Madanji, I think we are running short of time. So over to you, sir.
Thank you, Harishi. We are running short of time. Thank you. Thank you again, everybody. As these programs are only meant to be a taster, we introduce and spend a little time, but we can reach out to all our experts and discuss further. Thank you very much, Harishi.
Yes.
Pallavi-ji,
Over to Dr.
namaskar.
Pallavi.
Thank you, Dr. Madan. So I come to the best part of the session. I especially, I should thank Dr. Harish Verma for his brainchild of formulating these sessions and thinking of this in April and implementing it and bringing all these stalwarts on this platform to discuss these very important Ayurvedic concepts and herbal formulations. So thank you very much, Dr. Harish Verma-ji, for this wonderful, I think you are pioneer in these kind of session series, lecture series, which are going on. And I especially thanks to Dr. E. Sharma for being here with us and giving us so much of encouragement, hearing about Mauritius and how you're promoting Ayurveda and incorporating in your lifestyle. That's really fantastic. Thank you very much being here. Dr. Bhaspati, thank you very much for joining at the last moment and clarifying a very good point on herbal-mineral mineral aspects of those heavy leads. Thank you. Excellent talk. And now Dr. Shreyas and Dr. Tejas Mohan, you all have done a wonderful job. Thank you so much for spending this evening with us and sharing your thoughts. Thank you very much to our Dr. Narendranji and Satish Thakurji for supporting this very important platform. And I don't think so we could have made this more impressive without our collaborators, the European Ayurveda Association Academy, and Ayurveda Union of Midwest, where Dr. Ashlesha Raut is here with us, always attending these lecture series. Thank you very much. And thank you to Tathastu for supporting this technically, and Y Media, Prabhasi Medium, and the best as the viewers who spare their time and make this a very interactive session. And of all, I seek blessings from Lord Dhanvantari to give us more wisdom and move forward and take this further. Thank you. Next week, we are going to talk on Sitapaladi Churna, which is also very commonly used, but we would see it with a very different aspects and angle. Thank you. Goodbye. Have a good weekend.
Pallavi-ji, before we conclude, I think together with Ishji from Mauritius, we have a special guest, perhaps. Ishji, namaskar. I don't know, together you had somebody from Mauritius with you. I don't know if they wanted to say a few words. I don't know. I can't see them on the participant list, but there was somebody joining from Mauritius. And I also wonder if Narenji joining us from Delhi.
Dr. Narendra was there.
Was here with us?
He was here with us.
I think he has left.
Thanks. Harishji, has our guest from Mauritius left, or is?
Yes, I think he has left.
Okay.
So we'll invite them in next lecture again.
Next lecture.
Yeah.
Thank you all.
Thank you all. Thank you all. Namaskar.
Namaskar.